Hello and welcome to A Sound Constitution here on CHLY 101.7 FM, a show where we focus on health topics important to our community. This year's team is made up of 4 fourth-year VIU nursing students. Our goal is to demystify health issues and address common misconceptions by sharing evidence-informed information from a variety of reliable sources. All information provided on our show will be available in our show notes on our Facebook and Instagram pages. We want to remind our listeners that the information presented in this show is for educational purposes only and does not replace the advice of your primary healthcare professional. If you have any questions or concerns about what's being discussed, feel free to reach out to us on Facebook at A Sound Constitution, Instagram at CHLY A Sound Constitution, all one word, Twitter at ASC_VIU, or email us at asoundconstitution@gmail.com. We would like to start our show by acknowledging that we are on the unceded territory of the Snuneymuxw people, with a broadcasting range that overlaps the Kwetson and Slayamon territories. This acknowledgement is done with gratitude to the Snuneymuxw people and with the intention to increase awareness about truth and reconciliation processes and efforts on Vancouver Island. Additional information and resources surrounding Snuneymuxw history, reconciliation, protocol, and land acknowledgement can be found on our Facebook, Instagram, and YouTube pages. Without further ado, let's get started on this week's episode of A Sound Constitution. My name is Cameron, and I am your host today. I will be joined throughout this episode by my co-hosts Taylor, Dana, and Havin. Today we are going to talk about all things men's health. We're going to cover information about prostate health, testicular health, physical exams and assessments, sexual functioning, male contraception, and hormonal changes. We will also be joined by Mark Tiongson to discuss men and mental health. We are so excited to share this episode with you all, so let's get started. I'm going to hand the mic to my co-host Taylor to discuss testicular health.
Hello, thanks for tuning in. This is Taylor, and today I'm going to be talking about testicular cancer, including a brief overview of the prevalence, risk factors, signs and symptoms, and how to perform testicular self-examinations. So without further ado, let's get into it. Testicular cancer is rare, accounting for less than 1% of all cancers in males. According to Canadian Cancer Statistics, there were 1,200 cases of testicular cancer in Canada in 2021. This was an increase from 2020, where Canada saw 1,150 cases. Unfortunately, out of these cases, there were 35 deaths in 2020 and 35 deaths in 2021 due to this type of cancer. Although when compared to the prevalence of other cancers, testicular cancer is actually the most common type of cancer diagnosed in young men between the ages of 15 and 35. Fortunately, if detected in the early stages, the prognosis is good with a 95% chance of complete remission. When we talk about early stages, this means that the cancer has not yet spread to other parts of the body. Testicular cancer can spread to other areas of the body, including the lymph nodes, lungs, liver, bones, and the brain. The prognosis of this disease differs depending on where in the body it has spread. Because of this, it is so important to take the steps necessary to help detect abnormalities and monitor for signs and symptoms. This can be achieved by doing testicular self-examinations, which I'm now going to play a clip featuring Dr. Claudia Pastides, who is a general practitioner working with Babylon Health in London, UK, giving a short explanation on how to perform these.
Testicular cancer is the most common cancer in young adult men aged 15 to 40, and stats show that the earlier it is caught, the better the outcome and chance of being cured. Checking your testicles is quick, easy, and a great way of knowing what is normal for you. You probably already know them pretty well, but here's how to give them a proper check. A good time to do so is when having a warm shower or bath. Examine one testicle at a time, and if you've only got one, give it your undivided attention. Put your thumb on one side of the testicle and your fingers on the other, and gently, with light pressure, run your fingers over and around the whole testicle, checking for any lumps or bumps, pain, or swellings. Testicles tend to be quite lumpy at the back, and that is normal. It's actually where the epididymis lies, and the epididymis is a really long coiled tube that stores and carries sperm from the testes to the penis, and it can feel very different from the smooth surface of the testicle. Try to examine your testicles every month. By becoming familiar with your testicles and what's normal for you, you're more likely to spot any changes. If you do notice any changes in your testicles or you find a lump, talk to a doctor. We see this a lot, and the sooner you let us know, the sooner we can get it sorted.
If you're just tuning in, that was Dr. Claudia Pastides from Babylon Health providing a brief explanation on how to perform testicular self-examinations. As that clip mentioned, it is recommended that anyone with testicles 15 and older be taught and encouraged to perform these monthly, not only to check for any changes, but also so that they know what is normal for them and can better recognize if any change occurs. When doing this, it's also important to note any scrotal pain or swelling, which could indicate an issue that warrants a visit to your doctor. Pain in this area, rather than noticing a lump, is the reason approximately 10% of individuals diagnosed with testicular cancer seek medical assistance. So what are some other signs and symptoms? Well, a scrotal lump is a common symptom. These lumps are typically painless and very firm and can either develop slowly or quickly depending on the type of tumor. As I mentioned, scrotal swelling and pain can also indicate the development of testicular cancer, and feelings of heaviness have also been recorded as a symptom. In the very early stages, especially if the tumor is slow growing, there may not be any signs or symptoms until the lump has grown to the point where it can be felt. That's another reason why it's important to do monthly self-examinations in order to detect changes as early as possible. It's also important to mention that testicular cancer more commonly occurs in the right testicle, but both testicles should be given equal attention when performing examinations. Now, before I finish up, I'm going to address some of the risk factors associated with the development of testicular cancer. According to the Canadian Cancer Society, one of the main risk factors is a history of cryptorchidism, also known as undescended testicles. This means that one or both testicles did not descend into the scrotum before birth. If this occurs, the undescended testicle or testicles will sometimes move down on their own within the first year of life, but if not, then surgery is performed to correct it. Either way, the risk of testicular cancer is increased in both these incidences. Other risk factors include family history of testicular cancer and previous history of testicular cancer, meaning if cancer has previously developed in one testicle, there is a higher risk of cancer developing in the other. Evidence also shows that white individuals are 4 times more likely to develop testicular cancer than non-white individuals. Diet, injury to the testicles, or having a vasectomy are not risk factors associated with testicular cancer. If you would like to learn more about testicular cancer, please visit the resources posted in our show notes.
Thank you so much, Taylor. That was very informative. If you're just tuning in now, you are listening to A Sound Constitution at CHLY 101.7 FM. My name is Cameron, and I am your host today, and our episode is focused on men's health. My co-host Taylor just provided us with a wonderful introduction to testicular health. Taylor discussed testicular cancer and self-exams. At this point in time, I just want to remind our listeners that all information provided on our show is not intended as medical advice. Please discuss any questions or concerns with your primary care provider. In addition to testicular health, it is important to discuss the prostate. I'm going to talk a little bit about the prostate, including what it is, problems that may occur, and assessments that should be done. The prostate is a part of the male reproductive system and is responsible for producing seminal fluid, the fluid that transports semen. The prostate is found just below the bladder and in front of the rectum and around the urethra. It's about the size of a walnut. According to the Centers for Disease Control and Prevention, as a man begins to age, often the prostate grows. As the prostate grows, it begins to compress the urethra. This is called benign prostatic hyperplasia, often referred to as BPH. BPH is the most common urological problem in males. Risk factors for BPH include aging, obesity, lack of physical activity, smoking, and diabetes. Signs and symptoms of BPH include decrease in the force of the urinary stream, difficulty initiating voiding, bladder pain, and incontinence. Usually, complications are uncommon with BPH. However, the most common complications would be urinary retention and urinary tract infections. These complications may result in catheterization, surgery, and antibiotics. Transurethral microwave therapy, transurethral needle ablation, laser prostatectomy, and intraprostatic urethral stents are some minimally invasive options to treat BPH. If you are experiencing any symptoms of BPH, contact your primary healthcare provider for an assessment. To summarize BPH, let's listen to an audio clip from the Cleveland Clinic titled, "What Causes an Enlarged Prostate?"
When you gotta go, you gotta go. But imagine racing to the bathroom and not being able to empty your bladder. If you're living with benign prostatic hyperplasia, BPH, you just might know what it's like. In short, BPH means you have an enlarged prostate gland. But to fully understand it, let's take a closer look at how the prostate grows. Composed of glandular and muscular tissue, the prostate goes through two main stages of growth. It first grows during puberty and doubles in size. The second growth stage happens around 25 and continues for most of a person's life. BPH usually occurs later in the second growth stage, between the ages of 50 and 60. The prostate gland surrounds part of the urethra, the tube that carries urine and sperm out of the body. When it's enlarged, it's harder for bodily fluids to pass through the urethra, which is why common symptoms of BPH include trouble peeing, including a slow or dribbling stream or difficulty getting started, peeing frequently, feeling like you always need to go or needing to pee during the night, urine that's a different color or smells funny. Milder symptoms don't always need to be treated, but your healthcare provider will watch for any changes to make sure things don't get worse. However, more severe symptoms may require medications that can slow prostate growth or relax its muscles, surgical or minimally invasive treatment to widen the urethra or remove any tissue that is blocking it. And be sure to contact your healthcare provider immediately if you're noticing stomach or genital pain while urinating, pain, fever, or chills while urinating, blood in your urine, or not being able to pee at all. The cause of BPH is not well understood, but some researchers believe aging's effect on the testicles might lead to it. As the most common prostate problem, almost all men will experience enlargement as they grow older. 50% of men will show some signs of BPH by the age of 60. 90% of men will have symptoms of it by 85. Half of them will need to seek treatment. So, does having BPH mean you're going to get prostate cancer? The short answer, no. But since BPH and prostate cancer have similar symptoms, it's possible to live with both at the same time. If you notice any changes, ignoring what's going on won't make things better. Neither will getting advice from friends on social media. Talk to your healthcare provider. They can review your family medical history, examine you for BPH, or suggest a prostate cancer screening if need be. BPH is quite common, so if you're living with it, you're not alone. Reach out to your doctor today to prevent further complications down the road.
Welcome back to A Sound Constitution. We just listened to an audio clip from the Cleveland Clinic titled, "What Causes an Enlarged Prostate?" Along with BPH, men are also at risk for prostate cancer. The Canadian Cancer Society states that prostate cancer is the most common cancer in Canadian men. It is also important to note that anyone who had a prostate at birth, for example, trans women and non-binary people, are at risk for prostate cancer. It is important to catch prostate cancer earlier, as this increases the chance of successful treatment. There are two tests that help with early diagnosis of prostate cancer: the prostate-specific antigen test, or PSA test, and the digital rectal exam. The PSA test is a blood test that measures the level of PSA protein in your blood. High levels of PSA in your blood indicate possible complications with your prostate. The PSA test does not diagnose cancer, however, high results prompt further investigation. The digital rectal exam is a physical exam of the prostate by a healthcare provider through the insertion of a finger to feel the shape and size and feel for any lumps or abnormalities on the prostate. Though invasive, these tests are important for early recognition of possible prostate complications, especially after the age of 50 or 45 if you are high risk. The Canadian Cancer Society states the signs and symptoms of prostate cancer include, but are not limited to, increased urinary frequency, urinary urgency, blood in the urine or semen, pain with urination and ejaculation, and pain or stiffness in the back, hips, and pelvis. Please check in with your healthcare provider if you are experiencing any of these symptoms. Thank you for listening to me talk about the prostate and importance of recognizing the signs and symptoms of prostate cancer early. Did you know that according to the Mental Health Foundation, men are less likely to access psychological therapies than women?
Did you know that according to Canadian Men's Health Foundation, inactive men are 60% more likely to suffer from depression than those who are active?
According to the Canadian Institutes of Health Research's report about advancing boys' and men's health, they found that 3 in 4 deaths caused by suicide in Canada are men. Men also experience higher mortality rates in many areas, including cardiovascular disease, diabetes, and accidents. Men have a shorter average life expectancy of 80 years compared to women's 84.
According to the Canadian Men's Health Foundation, colorectal cancer, which includes colon and rectum cancer, is the second leading cause of death from cancer in men. Approximately 1 in 14 men will develop this type of cancer in their life.
Welcome back to A Sound Constitution on CHLY 101.7 FM. My name is Cameron. Thank you for tuning in as we discuss men's health. I'm excited to welcome my co-host Dana. Dana is going to discuss vasectomies and common concerns.
Today we're going to talk about vasectomy, an option of birth control for men. Vasectomies have been a common procedure men can opt into since World War II. Interestingly enough, Canada has some of the highest vasectomy rates in the world, where an estimated 22% of Canadian couples who use birth control choose vasectomy as an option. This is actually even higher than tubal ligation, which is a method of sterilization for women that's more complicated, takes longer to recover, and comes with a higher risk for postoperative complications. Vasectomy success rates are about 99.85% effective, but they do not stop sexually transmitted infections, so that is something to keep in mind if you're at higher risk. When it comes to coverage, BC covers all forms of vasectomy under MSP. If you are not covered or choose to go to a private clinic, prices can vary anywhere from $700 to $1,600. To start this section, we are going to share a short audio clip from a video presented by Dr. Duncan Harris from East Falls Urology in Idaho regarding the procedure itself and post-procedure recovery. There is also a brief discussion about vasectomy reversal and some important information you need to know. The clip has been edited for time and to remove sections not equivalent to Canada due to our different healthcare systems.
Vasectomy is a procedure that's done in the office under a local anesthetic, but sometimes with the addition of an oral anesthetic to help relax or calm your nerves. The procedure is done through a single, very small incision on the front of the scrotum, through which the vas deferens, the tube that transports sperm from the testicles to the penis, is cut and occluded. Usually a single stitch is placed in the incision when the procedure is done. The procedure generally takes less than an hour. Probably the most important thing for a vasectomy is being prepared for the recovery. It's very important to have 2 to 3 days set aside with minimal activity planned. Probably the second most important thing is to have a bag of frozen peas or corn set aside to use to help prevent swelling. The stitch that's placed to help the healing will fall out on its own, usually in about a week. Generally, no pain medication is needed after the procedure other than simple over-the-counter Tylenol. Most patients will have just a routine follow-up in 1 week's time, just to check on the incision and make sure they're healing well. At that time, they're generally given a container and instructions for getting a semen analysis, which is usually completed at about 8 weeks after the procedure. Many patients will hear horror stories about the extreme amount of swelling that occurs with the vasectomy. If you follow instructions, the swelling and the pain should be minimal. Problems after vasectomy are quite rare, but things that you should look for and probably call your doctor with is if you were to have significant swelling, bleeding, fevers, chills, or a lot of redness of the incision. As I mentioned, vasectomy should be considered a permanent procedure, but vasectomies actually can be reversed. If a man chooses to have his vasectomy reversed, it's a procedure that is done in the operating room, usually under a general anesthetic. While in the operating room, an incision is made in the scrotum, and using a microscope, the tubes, vas deferens, are sewn together using very small suture. Even if the procedure is successful, there are no guarantees that he will be able to have children in the future.
When it comes to the types of vasectomies, there are a few different options. For years, the conventional method was using a needle to freeze the scrotal tissue and then using a scalpel to create a very small incision to access the vas deferens, which are the tubes that semen travel up from the testes to the urethra. The tubes are separated and they're either cauterized, which is basically scorching each end, or they are stitched, and this creates a complete block on both sides. Now we are seeing a vast increase of the usage of the no scalpel option, as well another new option, which is the no scalpel, no needle option. The no scalpel technique uses a small clamp with pointed ends, so the scrotal area is frozen just like the conventional method. Then, instead of using a scalpel to cut the skin, that pointed clamp is poked through the skin of the scrotum and opened, so it just creates a very small hole. The no scalpel, no needle option is less common, but it is seen in some of the larger centers. And what it does here is instead of using a needle to deliver the local anesthetic, it uses a special instrument called the MataJet. So the MataJet freezes the skin and the underlying vas deferens by using a high pressure spray rather than a needle, and then the doctor will use a clamp just like the other no scalpel technique. Post-operative side effects for vasectomy, such as scrotal pain, bleeding, and infection risk, are very minimal. The no scalpel techniques, however, offer some improvements over the conventional approach. In a 2022 update to the Canadian Urological Association's Best Practice Report, the authors noted the results of a Cochrane review, which is basically a gold standard of research analysis. The Cochrane review of 2 randomized controlled trials found that compared to the standard incision technique, the no scalpel approach is associated with even significantly lower risk of postoperative hematomas, so bruising, lower pain during surgery, lower postoperative scrotal pain, and less of a risk of wound infection. The Cochrane review also found it to be a faster procedure than the standard incision technique. However, there was no significant difference in the effectiveness, meaning the no scalpel technique is just as effective at sterilization as a conventional method. One last vasectomy option to discuss is a less utilized different approach on the vas deferens. The Vaseclip implant procedure is where the vas deferens are not cut, sutured, or cauterized, but instead clamped with a specialized clip. This may reduce pain, though it is not as effective for sterilization as the other methods, meaning an increased risk of failure. So in other words, an increased risk of unplanned pregnancy. For our last section, I want to briefly address some of the common myths about vasectomies when it comes to sexual functioning and the increased risk of prostate cancer. When I started my vasectomy review, I decided to check out what some of the discussions were across Reddit, Facebook, and Twitter. I started to notice an increase in language that vasectomies were about being castrated and giving up one's manhood, and that rhetoric is wildly inaccurate. A vasectomy is not castration. A castration is a complete removal of testes. Vasectomies do not remove the testes. They just create a separation along the tubes of sperm used to travel, so it creates sterilization. During our literature review for this episode, and what that is a process where we review current peer-reviewed research and literature from experts in their field, we found consistent reports and evidence that vasectomies do not lead to a decrease in testosterone, they do not cause an increase in erectile dysfunction, nor do they decrease libido. Another topic that has a lot of confusion is whether vasectomies lead to an increased rate in prostate cancer. We found a systematic review and meta-analysis, which are considered to be the best types of research studies, that included 17 million men reviewed through 37 high-quality studies. I'm going to quote the plain language summary from the study by Badudajan et al. Quote, "In this study, we found an association between vasectomy and the risk of developing localized prostate cancer without being able to determine whether the procedure leads to a higher prostate cancer incident." Okay, so what does that mean? It does not mean that there is definitive proof that vasectomies cause prostate cancer. The key word in that plain language summary is association. Association is not causation. I'm going to use an example presented by Boston University. In their article about association and causation, they found statistical association between the number of people who drowned by falling into a pool and the number of films Nicolas Cage appeared in a given year. Amusing, isn't it? So when we're talking about vasectomies and prostate cancer risk, we need to consider the factors that increase risk of prostate cancer. Age is the largest factor, as prostate cancer risk increases rapidly over the age of 50. Genetics also has an influence, as does lifestyle. So those are all things that this massive meta-analysis also takes into consideration. We really want to encourage our listeners to find out the facts about vasectomies, prostate cancer, or any other sexual health concern they have by talking with a healthcare provider or utilizing credible resources for information such as Island Health or any of the provincial or federal health websites. So that wraps up our conversation about vasectomies. Thanks for tuning in, and I'll hand it back over to Cam.
Thank you so much, Dana. Next up is my co-host, Haben. Haben is going to now discuss how testosterone changes throughout the lifespan and erectile dysfunction.
Thanks, Cam. So, hormone changes are a natural part of aging. Where the hormonal changes in women are more dramatic, sex hormone changes in men occur gradually. In men, the production of testosterone and other hormones decline over the years. Let's focus particularly on testosterone. This hormone allows men to produce sperm and to develop and keep physical male traits. So during puberty, testosterone triggers changes in the body, making the penis and testes larger to grow facial and body hair. The voice becomes deeper, and it also influences muscle mass and bone mass. Then the level of testosterone starts to decline around the age of 40, according to HealthLink BC. HealthLink BC is a website that provides reliable, non-emergency health information that has been medically approved, and it is available for anyone in British Columbia to access. So let's go back to low testosterone. Low testosterone is also called testosterone deficiency or hypogonadism. HealthLink BC states that low testosterone can lead to problems such as loss of sex drive, erection problems, infertility, and weakened bones. So, what causes it? Many things can cause low testosterone, such as trauma or injuries to the testicles, obesity, poor sleep, including obstructive sleep apnea or shift work, alcohol, problems related to pituitary gland or hypothalamus, and of course, aging. Canadian Men's Health Foundation states that there does not appear to have any conclusive evidence that low testosterone is hereditary. However, this is not really understood and more research is needed. And so I'm going to read out to you a list of some of the common symptoms of low testosterone. Decreased energy, exercise tolerance, or the ability to develop muscle, and also the strength goes down. There can also be decreased ability to lose fat tissue. So if you have low testosterone, it can make it difficult to achieve weight loss. It's also associated with decreased mood and concentration, increased fogginess of mental clarity, decreased sex drive or libido, absence of morning or nighttime erections. There can be fertility problems and weakened bones. Now, let's talk about diagnosis. How is low testosterone diagnosed? A blood test is taken within the first couple of hours after you wake up in the morning. And if the results show low testosterone levels, you will have to do another test to confirm. Moving on to treatment. The treatment for testosterone deficiency depends on the cause and if it causes symptoms. So usually it is treated with testosterone hormone, and this is called testosterone replacement therapy. And this therapy may improve your sexual desire and help prevent bone loss. This can be done in different ways, like an injection, through a patch or gel on the skin, or a pill that you swallow, or a tablet that you place in between your cheek and gum. These methods are typically for men who do not desire future fertility. The men who desire potential fertility in the future needs to avoid exogenous forms, which is external factors of testosterone, because that will shut down sperm production by suppressing the hypothalamus and pituitary glands. So the hypothalamus is located in the brain and is basically the master regulator, and it coordinates the hormones to be produced in the pituitary gland. And when you use testosterone replacement therapy, what happens is that the hypothalamus thinks that, oh look, there's testosterone. I guess I won't have to produce as much. And so it leads to decreased amount of testosterone production. Therefore, these individuals instead, medications such as clomiphene citrate or aromatase inhibitors are sometimes recommended. But it's really case by case and it's different for everybody. And it's also important to know that with medications, there are always a list of side effects that may or may not affect you. So here's a list of some of the side effects of testosterone therapy. Blisters, itching, or redness on the skin under the testosterone patch can be found. There can also be some soreness or increase in the size of the breast. Symptoms of an enlarged prostate can occur, such as trouble urinating, sleep apnea, mood changes if testosterone levels fluctuate too much, and some people may even experience acne or oily skin or hair loss. Testosterone therapy typically will result in the suppression of sperm production, so it is always important to have a discussion with the physician. Additionally, high testosterone levels can lead to an increased production of red blood cells in the body, leading to something called polycythemia, where there's too many red blood cells, and so the blood gets thicker and can put you at risk of further complications. It's totally normal for testosterone to decrease as you age, but here are some strategies on how to improve testosterone production. Be active. Exercise helps maintain and optimize the natural production of testosterone. Being healthy and having low levels of fat and high levels of muscle can also encourage the maintenance of higher natural levels of testosterone. However, extreme high volumes of aerobic exercise can lead to lower testosterone levels because too much exercise depresses the regulators of hormones to make less testosterone. So, you need to find a happy medium. Good sleep hygiene can also help. Getting healthy and regular sleep has been associated with better testosterone production levels. And drinking smaller amounts or no alcohol helps maintain normal testosterone levels. And now, I'm going to quickly go over some information about erectile dysfunction as well. Erectile dysfunction is the inability to achieve or maintain erection adequate for sexual activity. It is otherwise known as erectile impotence. It's common to have erection problems every now and then and can occur at any age, but they are a bit more common as you get older. Canadian Men's Health Foundation states that erectile dysfunction typically occurs in approximately 10% of the decade. For example, 20% of 20-year-olds, 50% of 50-year-olds, and 70% of 70-year-olds. The only exception to this is that it occurs in 49% of men over the age of 40. Erectile dysfunction, or ED, may be caused by physical, mental health, or as a side effect of certain medication. Let's talk about the physical health first. These include injury to the nerves, so that nerve signals do not make it to the penis adequately, loss of blood supply, or surgery. There's also something called a Peyronie's disease, which is when a scar tissue causes the penis to bend, curve, or lose length or girth, which can be very painful. There's also psychological causes like depression, stress, and anxiety, or any time when stressors, anxiety, or thought patterns make it difficult to get or keep an erection. Blood pressure medications can also cause erectile dysfunction. So if you're experiencing ED as a side effect, it's best to talk to your primary care provider to consider trying different medications. Additionally, diabetes puts men at increased risk of erectile dysfunction over time because diabetes in the long run can create disease of the small arteries and capillaries within our bodies. If you would like to learn more about erectile dysfunction, the Canadian Men's Health Foundation has a lot of great information about the different causes, some risk factors, and goes into detail about treatment and prevention, and answers some of the most frequently asked questions. It also covers coping, which is super important, and there's also strategies for individuals to help their partners cope with erectile dysfunction.
According to the Canadian Institutes of Health Research report, Advancing Boys and Men's Health, 5.8% of men in Canada reported childhood sexual abuse. Although 1 in 8 men in Canada have experienced unwanted sexual behavior in public, men's experiences with sexual violence are often stigmatized. Gay and bisexual men are 3 times more likely to experience unwanted sexual behaviors compared to heterosexual men.
Thank you for tuning in to A Sound Constitution on CHLY 101.7 FM. I'm your host, Cameron, and today we are discussing all things men's health. So far, we have discussed prostate and testicular health, sexual functioning, vasectomies, and hormones. Next up, my co-host Taylor and I will be sitting down with special guest Mark Tiongson. Mark is joining us to discuss men and mental health. Mark is a registered nurse working in mental health and an instructor in the Bachelor of Science of Nursing program at Vancouver Island University. We're looking forward to learning more about his experience working with men and mental health. So, without further ado, let's get started. All right. Well, thank you so much, Mark, for joining us today. We're excited to learn a little bit more about your work in mental health.
Thank you for having me.
Can you start us off by telling us a little bit about your experience working in mental health?
So I graduated with my BSN in 2007. I did a few practicums in adolescent mental health, and I started working as a child and adolescent psychiatric nurse in 2007. Worked inpatient in an emergency unit for a few years. Ended up being the clinical nurse educator for the child and adolescent psychiatric stabilization unit at Sir Memorial Hospital. I was teaching in the BSN program over at Douglas College. I did that for about 7 years and with a mental health focus. So doing a lot of mental health theory as well as mental health clinical. I moved to Nanaimo about 4 years ago, 2018. I've been teaching at Vancouver Island University since then, doing the mental health nurse 210 courses as well as mental health clinical. And I also work as a mental health clinician, as a case manager in community mental health here in Nanaimo. So so it's been a few years of gathering experience in mental health and learning through harm reduction and learning through trauma-informed practice and psychosocial rehabilitation and kind of passing that on to students, but also continually to practice that and kind of in servitude of the Nanaimo community. So yeah.
Wow, you have a lot of experience. Is there anything that inspired you to work in mental health?
I think for me, it was the fact that in mental health, the biggest tool in mental health is the ability of the practitioner to establish rapport and to connect. And I've always promoted that as a skill. I know we talk about skills in nursing in labs, and a lot of it is based on kind of the psychomotor skills. And I know the pressures you guys feel about perfecting these skills, and they are important, but I'm a huge proponent of establishing rapport and connection and trauma-informed practice as a skill. And that's where I've always felt most comfortable, because of the fact that I see the importance of it and maintaining those connections with people. And so, I think that's why I dived into mental health, is because understanding that as a skill, but also understanding it's the connections you can make with clients in mental health are vital in terms of their recovery and their connection to other resources. And so I think that's what always drawn me to mental health. And I have sausage fingers, so it's really hard to do in general, and stuff like that. So
awesome. Well, thank you so much. We need more people that are willing to put in the time to work in mental health and that are passionate about it like you are.
I agree. So this episode's all about men's health, and I've read that men are less likely to seek help for their mental health when compared to women. Why do you think this is, and what do you think can be done to encourage more men to seek help and use the services available?
So that's completely true, and it's the stigmatization towards that a man is not allowed or they need to hide sort of what they feel, or a man should not feel the pressures of mental health and mental illness and all those things. A lot of the statistics that show the percentage of men and women that have depression, borderline personality disorder, anxiety, they're often skewed because of the fact that it is of reporting statistical data, and most men aren't willing because of what they've seen as deemed as weakness or lack of character, or the fact that that's not what it means to be a man, in terms of reporting or saying that you need help in terms of what's going on to you mentally. And a lot of times we hide what's going on with us mentally with physicalities or using substances or through aggression, things like that, which sometimes seen as more of what a man should be doing rather than experiencing mental illness. And so I completely agree with that. This statistic, and a large part of it is because is what we deem as what a man should be and what a man should feel, is that of that stoic, not sharing their feelings and continuing on, and to be bearing the burden of kind of being a provider and protector, and having that armor instead of being vulnerable. And I think that creates kind of where we're at right now in terms of men not being able to feel comfortable in disclosing that they're struggling.
Mm-hmm. Yeah, I think I've seen that too in my own work as a student nurse. Along with the whole stigma that you were talking about there, do you think toxic masculinity and like the media have any impact on men's mental health?
I remember looking at this question and just feeling a bit guilty, just because I think growing up and playing sports and like locker room talk, I'd be so hypocritical to say that like you can't like toxic, like I've been a part of toxic masculinity. I think there's components of kind of myself that still engage in toxic masculinity, and I understand that it's harmful, and especially in terms of like how women are treated, and also like what a man should be. I think growing up in sports culture and growing up in kind of the locker room talk and the way courting women, it wouldn't be even called courting women in terms of like toxic masculinity. I think I'd be hypocritical to say I've never engaged in that, and I think I still continue to, and I feel kind of ashamed of it, kind of talking about it now. But it's mostly a big part of it is because I got a young son now who's a year old, and I kind of look at him and just hope to be a better example of that for him, because I think I'm sitting here being a contributor to masculine toxicity, even though I understand that the proponents of it are harmful to mental health of both men and women. And it was a tough, when I was reading through those questions, I don't think I've ever really spoken about it in kind of a public setting like this. And I think if I'm going to be honest with myself, there's things about toxic masculinity that I think all men should really need to face and understand that what it's contributing to this problem we're having in terms of the way the patriarch is still at the forefront of kind of men and women's health and our biomedical model and the way things are being treated. And I'm for sure a hypocrite of that, if I'm promoting mental health and mental wellness and equality and working in a nursing program. And I think kind of my son, who's being raised by my beautiful wife, who's strong and independent, and as well as my mother-in-law and my mother, who are also strong, independent women and have gone through kind of the trials and tribulations of toxic masculinity themselves. I think I'd be first to admit that I'm a hypocrite of. I don't want to be a hypocrite of that, because I'm definitely have contributed to it, and I think that's why I'm excited about this interview, is because I'm willing to say that and also be able to move forward and learn from that in terms of being a better example for my son. So, yeah.
Wow, thank you. I think it's really important that you've demonstrated that you have such self-awareness of how toxic masculinity is almost embedded within our society and how it impacts you and your family and our community as a whole. I'm going to throw something at you. You mentioned trauma-informed care and harm reduction. Are you able to just talk a little bit about that for our listeners?
Well, trauma-informed practice is an understanding that that people that come into our care or society in general have experienced some sort of trauma in their lives, whether that's neglect, abuse, loss of connection, substance use. So all those things entail that trauma has created both mental illness and cognitive issues, respiratory issues, heart issues in our response to trauma. So what trauma-informed practice helps us understand that we as practitioners in the healthcare field are not inducing more trauma to our clients. So what the issue is in the biomedical model is that we often, as nurses, stigmatize substance use. We stigmatize certain behaviors associated with coping with trauma. We stigmatize using our language. right? Calling people addicts or junkies or crackheads or things like that. We stigmatize mental illness, saying, why can't they just get a job, or why can't they just clear from their depression? So healthcare practitioners are actually huge proponents of inducing trauma within our clients. And so trauma-informed practice helps understand the effect of trauma in terms of the neurobiology and the neuroplasticity of, and the effects of in terms of cardio and respiratory issues and other forms of chronic illnesses, how trauma affects that, and how we need to be more trauma informed, as because we're actually inducing more illnesses with clients that come into our care. So that's what the really pish posh kind of way of talking about trauma informed practice is. But really, it's understanding that we have so much power in terms of our way of being with our clients, and until we're still continually moving towards being more trauma informed, but a lot of times we're still inducing a lot of trauma when clients come into our care based on our language and our judgments. And we don't think we're doing that harm, but we're actually harming clients and breaking down the recovery and actually making them sicker by clients come into our care. And so trauma-informed practice is a focus on the responsibility we have as practitioners because of the neurobiology associated with trauma. And if you look at the statistics of trauma, the majority of our population has experienced some sort of trauma.
Yeah, thank you. That was a really good description and overview of trauma-informed practice and the importance of using it in healthcare.
Let's take a short break to discuss some facts about men's health. We'll be right back to this interview. Did you know that according to Men's Health Foundation, men who climb 50 stairs or walk 5 city blocks a day may lower their risk of heart attack by 25%?
According to the Canadian Men's Health Foundation, only 30% of Canadian men's chronic health conditions are genetic, and the remaining 70% are caused by lifestyle. This means that men can reduce their risk of developing chronic health conditions by making healthy lifestyle choices such as staying active, eating healthy foods, getting adequate sleep, and watching their alcohol consumption.
According to Canadian Men's Health Foundation, men who sleep 7 to 8 hours a night have about 60% less risk of fatal heart attack than those who sleep 5 hours or less.
Welcome back to A Sound Constitution on CHLY 101.7 FM. We are currently discussing men's mental health with Mark Tiongson. Mark is a registered nurse and instructor of the Bachelor of Science in Nursing program at Vancouver Island University. So, without further ado, let's get back to it.
Do you have any advice for men who are currently struggling with their mental health and well-being?
I think there's this notion that men should speak out about their mental health. And I completely agree with that, but it's hard to. I think finding someone or something that you're comfortable in expressing that energy rather than just telling someone that they need to speak out or feel comfortable is really important, right? And sometimes that speaking out comes in terms of some sort of vocational activity, whether that's like exercise or a hobby or an interest. And sometimes that speaking out to someone doesn't mean to a whole group of people, but to be someone that they trust. Right. I think that's where we start. Someone you feel comfortable in sharing how you're feeling. And I think finding some sort of vocation to kind of help release some of that anguish and that feelings of stress is really important. I just don't think it's realistic right now to just say men should speak out, because there's a level of comfort that right. I even speaking as a mental health practitioner, we encourage finding connection with something or someone. It doesn't have to be a multitude of people. I think just having that one thing, and sometimes that's a professional, right? Sometimes that's using crisis counseling. Sometimes that's used like at Brooks Landing, that someone can be a professional that they can speak to if they don't have the comfort of finding someone in their family or friends that have that, right? And so I think focusing on just one vocation or one thing where you can kind of expel some of that energy to is really important.
Mm-hmm. I agree. Thank you for that perspective. I think you're right in saying that often everybody says just go ask for help, but a lot of people don't really know where to even start if they do want that further extended care and working with mental health practitioners. You did mention Brooks Landing. Is there any other resources in Nanaimo and surrounding areas that are specifically targeting mental health and possibly men's mental health?
I think that asking for help is a difficult part. I think seeking connection is kind of what we should encourage, not just men, but people in general. When you say asking for help, I think it's a challenge for people, but that seeking connection, and sometimes seeking connection is in some sort of vocation, or seeking connection with a mental health professional, or seeking connection with somebody. I think we have to change that language because asking for help is difficult, but seeking connection is a right that we have. It's one of the Maslow's hierarchy of needs, is having that connection to something. And so the opposite of addictions is actually connection, right? We often think that the opposite of addictions is abstinence, when the opposite of addictions is actually finding some sort of connection to something that gives you something to wake up for, something to look forward to. So some other resources that I know. The New Hope Center is a great, excellent for men's. It's the men's shelter downtown, but it's also associated with the Salvation Army. Nanaimo Family Life is a great support for individuals as well as families in terms of providing counseling. There is also Barron's Road Mental Health and Addiction Center, where it's a walk-in self-admit for any addictions support as well as any mental health support. Those are sort of the go-to ones that we use in helping clients find connection to men's resources, but it's all encompassing for sure.
Yeah, I feel like there are resources, but a lot of people don't really know about them. So it's important to bring awareness to them.
The Vancouver Island Crisis Line is another also great resource.
Oh yeah, thank you for that.
Especially since they can connect you to more men specific resources as well. But the Vancouver Island Crisis Line is a good place to start.
Now, what would you say is the most important lesson you've learned over your career as someone working in mental health?
I kind of simplify it to like it's a gift that people are coming in terms of like seeking connection or looking for support, and it should be treated as a gift. And I think simplified as just focus in trauma-informed practice, focus in harm reduction, focus in psychosocial rehabilitation, like the evidence-based, not practicing in terms of non-judgmental care, in terms of using empathy, is actually not practicing in what is required. It's like giving a wrong med. It's the same thing as hanging the wrong IV bag. It's the same thing as not supporting clients with their ADLs. It's the same thing as not changing your IVs in 24 hours. It's not the same thing as not checking your vital signs. It's those sort of kind of behaviors you think that are not a big deal, but they're actually the same thing as making a med error and all those things I have mentioned. So yeah. You
mentioned how men should seek connections. Is there anything you would recommend that they do to better their connections and supports?
I think it's a big part of it is just self-confidence in kind of yourself, right? When I mean building connection in something or someone, I think that ultimately builds your sense of self-worth and who you are. And so does that kind of what we're leading with in terms of your question, right? I think when you have built your self-worth, you do feel okay with feeling vulnerable and understanding that I need help. And so that's why I say focus on building connection, because I think when you feel connected to, and it doesn't, being connected doesn't mean having like 1,000 friends on social media, right? Feeling connected means having some sort of feeling of warmth and understanding of something to look forward to, whether that's connected to going to the gym or connected to being outdoors or being connected to someone or something, or it can be connected to a pet. I think that ultimately builds your self-worth and feelings of like I matter. And when you feel like you matter, I think that's where you start being more open to being vulnerable and seeking support and all those things. So I really am focused on kind of helping people find connection, and that's what the kind of foundations of psychosocial rehabilitation is finding connection in terms of community and goals and things like that. So
well, thank you. Is there anything else you'd like to tell our listeners?
There's a responsibility that comes with being a medical practitioner, a nurse, the responsibility of advocation and responsibility for the care of people that need support. It's the responsibility of supporting clients in terms of their most dire needs. And I think and that responsibility doesn't just go on like a 12-hour shift. You're given that responsibility as soon as you accept the role of being a nurse, and that already started when you guys are first year in nursing, and that doesn't change. I think we have to understand that responsibility. You judge a community by how you treat marginalized populations. And so I think we need to, and people with mental health and substance use are always at the detriment of kind of the social determinants of health, and how we treat them and our resources towards them are kind of what shows where our community is. And so I think that's how you judge kind of where we're at in terms of our role as nurses and our role as practitioners.
Mm-hmm. Yeah, it's true. Be kind to everyone, because you don't know their story.
Yeah.
Awesome.
Thank you for having me.
Yeah, thanks for being here.
Yeah, thank you so much, Mark. We really appreciate learning more about your perspectives and what it's like to work as a mental health professional. So yeah, thank you so much for joining A Sound Constitution.
Thank you. Take care.
Once again, thank you for tuning in to A Sound Constitution on CHLY 101.7 FM. My co-host Taylor and I just sat down for a wonderful interview with Mark Tiongson, a registered nurse, mental health practitioner, and instructor in the Bachelor of Science in Nursing program at Vancouver Island University. During the interview, Mark discussed the stigma surrounding men and mental health and the impact it has on our society as a whole. Mark also demonstrated vulnerability while discussing how toxic masculinity has played a role in his own life. I think one of the important reflections from Mark's interview is to be kind to one another. You never know what traumas and experiences that someone else has been through. If you are struggling with your mental health, please call the Vancouver Island Crisis Line at 1-888-494-3888. On behalf of A Sound Constitution, I would once again like to thank Mark Tiongson for joining us today. And I would also like to thank our listeners for tuning in to A Sound Constitution and learning about men's health. We hope you have learned something new. For details and show notes from today's episode, or to follow along on what's coming up this season, check out our Facebook page, A Sound Constitution, our Instagram, CHLY A Sound Constitution, or our Twitter at ASC_VIU. If you've missed parts of this episode, or you would like to listen to this episode or episodes from our past shows, check out our YouTube at A Sound Constitution. Otherwise, we'll see you all next time.